Introduction. Amoxicillin is a broad-spectrum antibiotic belonging to the penicillin class. It is commonly used to treat a variety of bacterial infections. 2. Class beta-lactam antibiotic penicillin group. 3. Mechanism of action. How it works. Amoxicillin works by inhibiting bacterial cell wall synthesis binding to penicillin binding proteins, PBPs, causing weakening and death of bacteria. It is bactericidal in action. 4. Spectrum of activity. Effective against gram-positive bacteria, Streptococcus, Enterococcus, Listeria. Gram-negative bacteria, E. coli, H. influenza, Proteus mirabilis. Less effective against beta-lactamase producing bacteria, unless combined with clavulanic acid. 5. Indications. Uses. Amoxicillin is used for respiratory infections, pharyngitis, tonsillitis, bronchitis, ENT infections, otitis media, sinusitis, skin and soft tissue infections, dental infections, urinary tract infections. H. pylori treatment, with clarithromycin plus PPI. 6. Dosage. Adults, 250-500 mg every 8 hours, or 500-875 mg every 12 hours, depending on severity. Children, dose based on weight, 20 to 45 mg/kg/day, divided into 2 to 3 doses. Duration, 5 to 14 days depending on infection. 7. Side effects. Common, nausea, vomiting, diarrhea, rash. Less common, allergic reactions, anaphylaxis. Rare, Clostridium difficile associated diarrhea. 8. Contraindications. History of allergy to penicillin or cephalosporin. Severe renal impairment, dose adjustments needed. 9. Precaution. Check for history of penicillin allergy. Adjust dose and kidney dysfunction can interact with allopurinol. Rash risk, reduces the effect of oral contraceptives. 10. Forms available. Capsules, tablets, syrup/suspension, drops, injection, less common than oral form.